Good morning, and thank you for joining us for our special non-COVID briefing today. Today, Health Commissioner Dr. Cheryl Bedegal will be joined by Dr. Ron Caron, Chief Medical Officer at the Children's Hospital of Philadelphia, and Dr. Tyler Brian Stevens, who is Senior Director at the Center for Health Equity at the Children's Hospital. Today's briefing is for press only, but as usual, we are live streaming on the Health Department's YouTube channel. Members of the public are encouraged to check the Health Department's social media accounts for the link to the briefing. Today's briefing will run till 10:30. As usual, we'll present the remarks first in English, then in Spanish, then I'll open it up to questions. We ask that media outlets coordinate internally to ensure that only one representative asks questions, and we limit questions to 3 or fewer. Please keep your questions focused on today's topic. With that out of the way, Dr. Bedegal, would you please start us off?
Sure. Good morning, everyone, and thank you for joining us. Because many people have relaxed their precautions against COVID, we are expecting a much worse flu season this year than last year. With hospitals already near capacity, even though flu is generally milder than COVID, even a small number of hospitalizations could overload our healthcare systems. We strongly recommend that everyone over 6 months of age get a flu shot to help stop transmission and to protect against flu and its complications. People at especially high risk for the flu include adults age 65 and older, residents of nursing homes or other long-term care facilities, children under the age of 2, pregnant people, and people with pre-existing conditions, including asthma, heart disease, and diabetes. You can get your flu shot at the same time as you get your COVID vaccine or booster, so there's no need to delay. Please keep in mind that flu spreads in the same ways as COVID, so avoid crowded indoor spaces. Stay home if you're sick and wear a mask when indoors around others other than your household members. Thank you.
Thank you very much, Dr. Bedegal. And now I'll turn to Dr. Caron to talk about what CHOP is seeing. Dr. Caron.
Thanks. Good morning, everyone. Flu season has begun, and at CHOP, we started to see kids in our primary care practices, emergency department, and inpatient units sick with the flu. This year, more than most, it's extremely important for your child to get the flu vaccine. That's because a lot of kids, particularly younger children, may be more vulnerable to flu infections because their immune systems have not been challenged to build immunity against the flu over the last 2 years when we've taken measures like social distancing and masking to prevent the spread of viral illnesses like COVID. But now, with many children returning to school, sports, and other extracurricular activities, kids are more likely to be exposed to the flu, and that could result in a much higher number of infections. Fortunately, we have a safe and effective way to prevent kids from getting the flu. It's the influenza vaccine, which is indicated for all children 6 months and older. Unfortunately, it appears that the percent of kids vaccinated against flu this year is several percentage points lower than it was in the last 2 years. I'm very concerned about what this could mean for children's hospitals this winter. All hospitals, but particularly children's hospitals, are struggling to manage the large volume of patients needing inpatient care. Since July, CHOP has been routinely operating close to or above 100% capacity. During flu season, we always see a spike in hospitalizations due to the flu. And if we have a particularly bad flu season this year, it'll make it challenging for us to provide care to all the children who need it. To help us avoid this situation, please get your child vaccinated. Do it for your child, to reduce the chance that they'll get sick or need to go to the hospital with a bad case of the flu. Do it for other children who depend on the Children's Hospital for life-saving care. Do it for yourself and your loved ones, especially grandparents and aunts and uncles who could catch the flu from your child and require hospital services when hospitals are already feeling the strain of caring for a lot of patients. That's why we're asking all of you to join us. It's a call to action and a rallying cry. Be a flu fighter.
Thank you very much, Dr. Caron. And now, Dr. Brian Stevens, please.
Good morning. Listen, this has been a tough 2 years for parents who are doing their best to keep their children healthy and safe during the pandemic. And I applaud all of you, and I'm really grateful for all of your efforts in caring for your children. So it's no surprise that just as the pandemic has been more detrimental to people of color, we're also more likely to experience higher rates of severe influenza illness. And this is very worrisome for me. According to the Centers for Disease Control and Prevention, Black people have the highest flu-related hospitalization rate. American Indians, Hispanics, and Latinos follow close behind. Unfortunately, this is even worse for our Black and brown children who have more hospitalizations and intensive care admissions, with deaths up to 4 times more likely in our babies less than 4 years old. And this year, as Dr. Karen mentioned, we have already seen twice as many emergency room visits at CHOP from flu than we did 2 years ago. And then there's many of you who are parents of children with chronic diseases such as asthma. And you know that this time of year is particularly hard for children who have asthma to breathe. For children who have asthma, their airways become swollen, produce mucus, and spasm when infected with the flu virus, and therefore more likely to have asthma attacks and to be hospitalized. So as a primary care pediatrician, mom and grandmom, I know what it's like to care for patients and loved ones who have asthma, and I personally do everything I can to keep your children, my children, and my grandchildren well and protected from flu. So for this reason, I strongly recommend that you get your flu vaccine, and you get your flu vaccine for your children this year. Each year, my entire family, including my grandchildren, get their flu vaccine. And my daughter, husband, and grandchild, all who have asthma, have not had to go to the emergency room or hospital because of flu infection. Therefore, what we're trying to say is that hospitalizations and deaths can be prevented. Just get your flu shot today. We want to partner with you to be a flu fighter. This is the very best thing you can do to keep your child healthy during the flu season. Thank you.
Thank you very much, Doctor. And finally, we'll have Zelly translate all 3 sets of remarks.
Las palabras de la doctora Berigol. Debido a que muchas personas han relajado sus preocupaciones contra COVID, esperamos una temporada de gripe mucho peor del año pasado. Con los hospitales ya cerca de su capacidad, a pesar de que la gripe es generalmente más leve que COVID, incluso un pequeño número de hospitalizaciones podría sobrecargar nuestros sistemas de salud. Recomendamos encarecidamente que todas las personas mayores de 6 meses de edad se vacunen contra la gripe para ayudar a detener la transmisión y protegerse contra la gripe y sus complicaciones. Las personas con un riesgo especialmente alto de contraer la gripe incluyen adultos mayores de 65 años, residentes de hogares de ancianos y otros centros de atención a largo plazo, niños menores de 2 años y personas embarazadas, personas con infecciones preexistentes como asma, enfermedades cardíacas y diabetes. Puede vacunarse contra la gripe al mismo tiempo que su COVID vaccine o refuerzo, por lo que hay necesidad de no demorarse. Tenga en cuenta que la gripe se propaga la misma manera que COVID, así que evite los espacios interiores abarrotados, quédese en casa si está enfermo y use una máscara cuando esté en el interior cerca de otras personas que no sean los miembros de su hogar. Ahora, las palabras de Dr. Karen. La temporada flu ha comenzado y en CHOP hemos comenzado a ver niños en nuestras prácticas de atención primaria, departamento de emergencias y unidades de hospitalización enfermos con gripe. Este año, más que la mayoría, es extremadamente importante que su hijo se vacune contra la gripe. Esto se debe a que muchos niños, particularmente los más pequeños, pueden ser vulnerables a las infecciones con influenza porque sus sistemas inmunológicos no han sido desarrollados a desarrollar inmunidad contra la gripe en los últimos 2 años. Cuando hemos tomado medidas como el distanciamiento social y el enmascaramiento para prevenir la propagación de enfermedades virales como COVID. Pero ahora, con muchos niños que regresan a la escuela, los deportes y otras actividades extracurriculares, es más probable que los niños estén expuestos a la gripe. Y eso podría resultar en un número mucho mayor de infecciones. Desafortunadamente, parece que el porcentaje de niños vacunados contra la influenza este año es varios puntos porcentuales menos que en los 2 años anteriores. Nos preocupa lo que esto podría significar para los hospitales infantiles este invierno. Los hospitales, particularmente los hospitales infantiles, están luchando para manejar el gran volumen de pacientes que necesitan atención hospitalaria. Después de julio, CHOP ha estado operando rutinariamente por encima del 100% de su capacidad. Durante la temporada de gripe, siempre vemos un aumento en las hospitalizaciones debido a la gripe y si es particularmente grave, podría dificultarnos brindar atención a todos los niños que la necesitan. Tendríamos que cancelar potencialmente las admisiones electivas. Para ayudarnos a evitar esta situación, por favor, vacune a su hijo. Hágalo por su hijo para reducir la posibilidad de que enferme o necesite ir al hospital con un caso grave de gripe. Hágalo por otros niños que dependen que el hospital infantil tenga la capacidad de brindar atención para todo tipo de problemas, no para la gripe. Hágalo por usted y sus seres queridos, especialmente sus abuelos, tías y tíos que podrían contraer la gripe de su hijo y requerir servicios hospitalarios, cuando los servicios hospitalarios son escasos. Si su hijo tiene 5 años o más, asegúrese de que también reciba una vacuna de COVID-19. Es seguro obtenerlos al mismo tiempo. Es por eso que les pedimos a todos ustedes que se unan a nosotros. Es un llamado a la acción y un grito de guerra. Sé un luchador contra la gripe. Ahora las palabras del Dr. Brian Siemens. Estos han sido 2 años difíciles para los padres que están haciendo todo lo posible para mantener a sus hijos sanos y seguros durante la pandemia. Te aplaudo por todos los esfuerzos en el cuidado de tus niños. No es de extrañar que así como la pandemia ha sido más perjudicial para las personas de color, también somos más propensos a experimentar altas tasas de enfermedad grave de la gripe. Esto es muy preocupante. Según los Centros para el Control y la Prevención de las Enfermedades, las personas negras tienen la tasa más alta de hospitalización relacionada con el gripe. Los indios americanos tienen el segundo más alto y los hispanos y los latinos tienen el tercer lugar más alto. Desafortunadamente, esto es aún peor en niños de minoría que tienen más hospitalizaciones y admisiones en la UCI, con muertes hasta 4 veces más probables en nuestros bebés menores de 4 años. Este año ya hemos visto al doble de visitas a la sala de emergencias con CHOP por gripe que hace 2 años en esta época del año. Muchos de ustedes son padres de niños con enfermedades crónicas como el asma. Esta época del año es particularmente difícil para los niños que tienen asma para respirar. El asma hace que las vías respiratorias se hinchen, produzcan moco y espasmo cuando se infectan con el virus de la gripe. Cuando los niños que tienen asma se afectan con la gripe, tienen ataques de asma y tienen más probabilidades de ser hospitalizados. Como pediatra de atención primaria, mamá y abuela, sé lo que es cuidar a los pacientes y seres queridos que tienen asma y personalmente hago todo lo posible para mantener a sus hijos, mis hijos y mis nietos bien y protegidos de la gripe. Por esta razón, recomiendo encarecidamente vacunarse contra la gripe para usted y sus niños. Toda mi familia, incluidos mis nietos, han recibido la vacuna contra la gripe todos los años y mi hija, esposo y nietos, todos los que tienen asma no han tenido que ir a la sala de emergencias o al hospital debido a los ataques de asma de la gripe. Estas hospitalizaciones y muertes se pueden prevenir. Vacúnese contra el gripe hoy. Sé un luchador contra el gripe. Eso es lo mejor que puede hacer para mantener a su hijo saludable durante la temporada de gripe. Muchas gracias. Thank you.
Thank you very much, Deli. We'll now move to the question and answer portion of our program. If you have a question, please use the raise your hand function, and we'll take those questions in the order received. As noted earlier, we ask that media outlets coordinate internally and keep their questions focused on today's topic. If there are any reporters who do not get the opportunity to ask a question or have questions about other topics, please follow up with us by email and we'll get you an answer. Additionally, I want to note that we are making these speakers available for interviews afterwards separately, so you can coordinate with us and we will get them to you. First up, we'll go to Alicia Reed from CBS 3. Go ahead, Alicia.
Thanks so much for taking my question. My question is about the COVID-related death that happened this week with the 16-year-old here in Philly. Would you say that the Omicron variant is deadlier for teenagers and children as opposed to the Delta or any of the other variants?
So we do not yet have information on the severity of the Omicron variant. So not able to comment on that. And you know, just to protect the privacy of the family during this difficult time, I also wouldn't want to comment on a specific individual.
Thank you, Dr. Bedigol. Alicia, do you have anything about the flu shot and the fact that we're seeing markedly lower flu shot rates here in the city?
Yes, with the fact that you're seeing fewer numbers, are there more cases now that you're seeing fewer numbers? Sorry, I hopped in about 5 minutes late.
So I'm not sure if one of my colleagues from CHOP would like to talk about what they're seeing at their hospital.
Go ahead, Ron. I was just going to say in the emergency room, as I commented, we just looking at our flu rate this year, we're seeing twice as many emergency room visits as we did 2 years ago. And last year we saw virtually no flu.
Dr. Karen, something to add?
No, I don't have anything to add. I would say that it's hard to know whether or not the reduced influenza vaccination rates that we're seeing at this time compared to previous years is contributing to the increased numbers, but we know that the flu vaccine is really the most effective way of preventing infections, and what we're trying to avoid is a very, very steep increase and a very high peak in the number of cases that we see. And you know, it's December. The peak is usually going to be in January or February, and we want to try to make it so that it's much lower than it was in the past.
Thank you very much, doctors. Alicia, anything else that we can help you with? Hang on a second. Sorry, you should be able to unmute now.
Thank you so much. No, that was it. I appreciate it. Thanks.
Thank you very much. Seeing no more questions, I will conclude today's briefing. Thank you all for joining us. And as usual, this recording is available on our YouTube account. Have a safe holiday.